Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Marc Brassard. He's with the Anne Arundel Medical Center. He's an orthopedic surgeon. Today we're going to talk about arthritis. Welcome.
Welcome. Thank you very much for having me.
So let's begin by talking about exactly what is arthritis.
So arthritis is normally when you look at any type of joint, you have a covering. This is a knee joint here. So the femur bone is on the top, so that goes from your hip down to your knee, and then the tibia is the lower leg bone, and that goes from your knee down to your ankle. At the end of all your bones, you have a smooth surface called articular cartilage. So you see it here, and it's blue in this model. And so what that is, that articular cartilage, I always say it's the Teflon that allows your joints to work, but it's like gold because we only have one layer of it. So what happens is, as people get arthritis, the blue stuff starts to wear away, okay? So basically, it's kind of like a sandwich. You're going to have less meat between the bread. So what happens is that keeps on breaking down over time. And so, unfortunately, arthritis is a progressive disease. So once you start getting arthritis, it's going to keep on happening. It really depends on the rate of it, depending on a lot of factors, your weight, your activity, genetics plays a factor in all that. There's some people that arthritis progresses faster than others, but the simplest definition of arthritis is the loss of the articular surface.
What types of arthritis are there? What's the difference between osteoarthritis opposed to rheumatoid arthritis?
So there's over 100 different types of arthritis that are known. Okay, the most common that 99% of people have is called osteoarthritis, and that's basically the general wear and tear of the joint. Okay, so that's just basically this starts breaking down. Traumatic arthritis is when people have the car accidents or injuries and stuff that can also cause arthritis. There's a huge range of over 100 called inflammatory arthritis, and that's where psoriatic, rheumatoid, all those type of arthritis are involved. What that is that's your body is actually, unfortunately, acting against your articular cartilage itself. So your body is creating mediators that's breaking down your own articular cartilage. So that's a whole different area of treatment and stuff, in a sense, than the osteoarthritis, because there are different medications that are involved with inflammatory arthritis rather than the osteoarthritis.
What parts of the body does arthritis usually affect?
It can really affect almost all of your joints. I deal mostly in hip and knee, but you know, we have hand specialists in our practice that will see a lot of stuff, like even with the thumb joints and stuff. Depending on what you do as a laborer or in your job, you can put extra stress on your wrist, your hand, you know, your thumb joints, that type of stuff. So it can affect any joints. The back is a very common area. You know, a lot of people have physical jobs where they have to bend over and lift things and carry things. And if they're not doing it properly, they put a lot of stress on their back and they can end up getting arthritis in their back also. So we really see it all over the body. There's not too many joints that are spared. You know, even like if you think about it, people that do things over their head all the time might end up, you know, getting some shoulder injuries or end up with shoulder arthritis as they get older.
What are the main things people should know about arthritis?
Basically, you know, arthritis is kind of, it's ubiquitous. Everybody gets some type of arthritis, right?
At some point in your life.
At some point in your life, usually as you get older. But what you have to do is learn how to manage it. You know what I mean? Like, just because you get it doesn't mean, you know, that you just have to live with it. You have to learn to work with it. You know, there's a saying, there's this book called Younger Next Year, and the saying that I always loved in that was, aging is inevitable, decay is optional. So what you do with your body as you get older, you could just sit around and not do anything and you live out your life that way, or you can go out and exercise and try to strengthen your body to try to alleviate some of the symptoms of arthritis and some of the problems of arthritis.
One of the things we mentioned during the last show was the fact that it can be a catch-22 situation. You're in pain. You're supposed to exercise because that's going to help you stay healthy, but you're in pain, so you don't feel like exercising.
Right. And that's where, you know, getting the proper diagnosis, first of all, is very important. So knowing if it is arthritis or a tendonitis or a bursitis, getting the proper diagnosis is important. And then from there, getting into the right exercise program. You know, even with the physical therapists around, the physical therapist, I always try to send people to physical therapy, even if it's just 1 or 2 sessions to get them jump started. Because a physical therapist can assess you, see what joint parts their body, even if it's just for your knee, they're going to assess how you're walking, how your hips are, how your back, your feet, all that stuff. So getting the right start in your fitness program is going to be very important, and I think physical therapy is a good way to start it. Like even in our office, we'll give general exercises, a sheet of exercises to show people how to do them. If they come back in 6 to 8 weeks and they're not doing better or they don't feel they're doing them right, then I'll send them to therapy. Some people we send to therapy right away. So I think getting the right start. But like I always tell everybody, there's something you could do to get better. You know what I mean? If you even have, I've seen people with horrible hip or knee arthritis that the joints barely move. Well, we can get them some type of exercise to get them moving. If it's in a pool, because a lot of people say, oh, I don't want to get in the pool or whatever. I don't look good in a bathing suit. It really doesn't matter because nobody really, what I mean? Nobody cares. Like if you go to any of those exercise classes in the pool, everybody's in the same boat. They're all just trying to get better. And it's very actually collegial in most of those settings. Like people actually support you and get you going. So like pool exercises is very good. Just either walking in the water or a formal exercise program in the pool is awesome exercise.
How about biking? Biking
is very good. That's what actually I do now, as I have a little bit of knee arthritis, so I've turned into biking. I used to be a runner and stuff. But biking is excellent because it allows you the things that you really need. It strengthens the legs because resistance on the pedals and stuff. You're also getting aerobic exercise. So it's building up your heart and getting your heart rate going a little bit, and it's also burning calories. So it's doing 3 really important things at the same time that you need. Because most people that have arthritis maybe do have to watch their weight a little bit, and that's also very important.
Arthritis runs in my family. My mother has rheumatoid arthritis, which is one of the reasons I wanted to do this show, to get a better understanding of the disease. Also, my brother, as a child, he had arthritis during his early teens.
Oh, yeah.
And do we see much of that childhood arthritis?
Yeah, unfortunately we do. I mean, there is a whole section called juvenile rheumatoid arthritis that some patients do get it at an earlier age. It's rare to get straight up osteoarthritis or something. Usually there's a predisposing factor, like a genetic factor or something that they're getting the arthritis is. So we do see it, and there's a lot of research going on through the Arthritis Foundation and stuff to try to see ways we could make that better. I used to be chairman of the Arthritis Foundation in Anne Arundel County, and we used to do walks and other fundraisers every year, and they have the young kids there that are 8 or 9 years old having rheumatoid arthritis, not being able to participate in gym class and stuff is heartbreaking. So it's really important, some of the research that's going on now, so all the kids have a childhood so they can go out there and play kickball and do all that stuff.
Interestingly enough, that's what not that he was cured, but that's what sort of helped him was exercise, wrestling.
Yeah.
That's and once he started with the wrestling, he got better.
Yeah. Because when people have arthritis overall, like some of the symptoms, people say, well, so what is it when you get arthritis? So basically, you can get stiffness in the joints, so you might lose a little bit flexibility or motion in the joint. Some people can get some swelling. Some people can get some generalized pain, or either localized or generalized in certain areas of the knees. And that stiffness and stuff, usually that's one thing exercise helps with. Like, because if you notice in the wintertime, in the early spring with all the rain and stuff, people have their joints are a little tighter. They don't move as well. And that's why some people go to Florida, Arizona during the wintertime because it helps their joints out. In the summertime, you're usually a little bit freer. So that's why even in the wintertime, living in this area, I always tell people you got to find even an indoor activity that you could do. We have people that are mall walkers. They go to the different malls and they do that. I have people that go to the Home Depots, which are pretty big. They'll walk around the Home Depots a few times. Or even at your house, get a stationary bike or a recumbent bike. Do something where you can go and get exercise, especially in the wintertime, because it is a little bit harder to keep your joints moving and get going.
Well, I'm a yoga instructor as well, so I recommend yoga.
Yeah, yoga is very good overall. As far as when we're talking about general health, the yoga and Pilates, those type of things, Tai Chi, those are all exercise things that people could do. And for different levels too, you know what I mean? I have patients that are in their 80s that do chair yoga and stuff. So I always tell people, you can find the right class. You might have to look a little bit, but you can find a class that will work for you. So I think that's going to be the important factor in this, is maybe a little effort, and sometimes the kids might have to help out. You know, the adult children might have to look around or make some phone calls or, you know, Google something and find it. But if you find the right class and the right instructors, then I think it's very helpful.
I do a chair yoga class, and I have people there who are in their early 50s. I have people there who are in their 80s.
Yes.
So you've got a wide variety of people who are there for different reasons, and you are so right, you have to find the right class.
Right.
I want to go back to being diagnosed for arthritis. What are some of the things? Do you take an x-ray, or how can you tell that someone?
So basically, getting the right diagnosis is important, okay? Because most people, you know, think they have arthritis once they get in their 50s, 60s, but they might not have arthritis. So usually you set up an appointment, you see either your primary care doctor or an orthopedic doctor. And the key is, first thing we always do is we always take a history. We ask where the pain is, how did it start, how long have you had it, what makes it better, what makes it worse. Then we do a physical exam. We make sure that the joint has full range of motion. You know, like if somebody isn't able to bend their knee all the way back, if they only can bend it back a certain part, or they cannot extend it all the way, we look at all that. We look at the alignment of the leg. Most people, when they get arthritis, if they get regular osteoarthritis, 85% of the people will wear out the inside of their knee first, okay? So I always tell people, this is a right knee model here, so this model, the person has lost it more on the inside than on the outside. So that's why I always tell people they become bow-legged. So most people, as they get arthritis, look like John Wayne coming off the range because they're bow-legged. Only about 10 to 15%, and that's usually more of the inflammatory arthritis, like rheumatoid, will become more knock-kneed. So if you look, most people do become more bow-legged than they do knock-kneed. And then there are patients that wear out both sides equally, or they just get arthritis underneath their kneecap, so their alignment kind of stays the same. But most people that I see are bow-legged by the time we see them coming in the office. So we get the x-rays, and usually we get a standing x-ray. And what happens is, on the good knee model here, so this shows, you know, you have full surfaces on both sides. So if I shot an x-ray here, this is like a sandwich, I would see space in between the bones on the x-ray. So when somebody says they have bone-on-bone arthritis, which is a kind of a common saying I hear people say, what that means is that we shot the x-ray, and since there's no blue stuff on the inside, the bones are going to be touching, and that's the bone-on-bone arthritis people talk about.
Sounds painful.
And it does, and people say they could feel the grinding, because as you see, there's the uneven surfaces in there, and it's kind of all these potholes, and what happens is they'll kind of grind and move in there. Every once in a while, you might hit one of these bare areas, and it causes your knee to just give way or buckle. So it's kind of like reflex. It only goes up to your spine. It just comes through, and it tells your leg to give out to get off of that spot. And it's scary if you're on stairs or something and that happens. So the key to this is the history, the physical, and then we get the x-rays. And so once we get the x-rays, we're able to explain to them how much their arthritis is. Sometimes people come in and they'll have knee pain and they'll assume it's arthritis, but it might be something else. The x-rays look good, but they have pain right along the inside of their joint. Sometimes people have a meniscus or cartilage tear. These two white rings here that you see, the bigger ones on the inside, the smaller ones on the outside, these are cousins of the blue stuff. They're a different type of cartilage, but these are like steak gristles, and they are on the outside of the joint to help cushion the joint and help stabilize the joint. So what happens sometimes when somebody says they tear a cartilage or a meniscus, they're tearing this thing usually in the back corner. So that's a totally different diagnosis than arthritis. And usually to diagnose it 100%, usually we have to get an MRI. MRI shows soft tissue better. X-ray does not show soft tissue at all. We only infer on the soft tissue because of the blue stuff not being there. But the MRI is what shows us a meniscus tear.
Well, let's talk about living with arthritis. How are the medications today opposed to what they were years ago? Have we gotten to a point where we have enough different types of medications to really allow someone to live comfortably?
You know, that's a great question. I think in the inflammatory arthritis world, which is, you know, the rheumatoid and psoriatic arthritis and stuff, they are getting better medications and things have improved. In the general osteoarthritis, which I deal with on an everyday basis, there are different anti-inflammatories, but a lot of them have the same side effects. So nowadays, even Motrin, Advil, Aleve have the same warning effects that some of the stronger ones like Celebrex and Meloxicam have. If everybody remembers, like 10, 15 years ago, Vioxx was a big medication that everybody loved, and they took it off the market because they were worried about heart issues with that. So you still have to worry about that, unfortunately. So for osteoarthritis, the Motrin, Advil, Aleve, which are the over-the-counter ones, still have the side effects. You know, I still have patients that can't take them because they have ulcer issues or stomach issues, or they have bad blood pressure issues. Some people retain more fluid with them. So there are side effects to them, or people who are on Coumadin or any type of blood thinners can't take usually the anti-inflammatory. So I'd say the medications as far as osteoarthritis are a little bit better, but they haven't really changed a lot in the last 20 years. So that's where the other treatment options are more important.
What about the holistic, some of these holistic drugs or vitamins or whatever? What is it, glucosamine?
Glucosamine, yeah.
Yes.
So glucosamine has been around a long time, and it really started with like dogs and horses and stuff like animals. So glucosamine, the studies that have looked at it have been really kind of mixed whether or not it makes a difference. I mean, some studies show that it helps people, and other studies say it didn't make any difference at all. And so normally when you talk about glucosamine and chondroitin sulfate are what kind of makes up the blue surfaces here. But they don't really replace it. Like if you see it on the bottle, sometimes on the packaging, they might show an x-ray that shows space after taking it. It doesn't really rebuild the cartilage. That's kind of like false advertising. Sometimes the researchers think it acts more like an anti-inflammatory than anything else, but it doesn't really rebuild the surface. But like the glucosamine, normally you have to take about 1,500 milligrams a day, and the chondroitin is 1,200. And you usually got to take them together. But like I said, I've had probably half my patients tell me it works, the other half say it doesn't, and that's kind of what the studies say. So there's no good research. Usually you got to take it for about 3 months to notice a difference. And I always tell people, you got to, you know, buy it from a reputable place. You don't have to get the most expensive stuff, like some of it's $70 a month or whatever. You don't have to get that. Consumer Report, I think in 2004, did a report on it, and they said if you get it like at the Sam's or Walmart, you know, made in the United States, it's usually going to have what it's supposed to be. If you're buying it from an out-of-country source, it might not even have glucosamine and chondroitin in it. There's no oversight as far as that goes.
We've also seen these products, the copper products,
yes,
that are supposed to work. I don't understand how it works.
Yeah.
Does it work?
Yeah, basically, you know, like with copper products, magnets, all those things have been out there. And there's no studies that show they work. You know, there's anecdotal studies, you know, like Aunt Susie tried it and it worked and stuff like that,
Yes.
and they'll have those commercials. But like I was just explaining to a patient, if those really worked the way they said, there would be a run on the stores, and you know, everybody would be getting them. So there's no studies that show they work. I mean, I've trained in Birmingham, Alabama. I grew up and went to medical school in Massachusetts, so all up and down the Eastern Seaboard. I could tell you, I mean, I've had patients put kerosene rags on their knees before because they were told that that would help them. I've had people spray WD-40 on their knees before because they've heard that would help them. And I usually tell people, when I give talks, you know, in Annapolis or Bowie area on this subject, I always tell people, if it doesn't give you cancer or kill you, you could try it. But there's no research to show any of those things work. So most of the stuff we deal in is research-based, and there's some science behind it. The glucosamine people like because it is an over-the-counter product, so they feel like taking that is better than taking like a Motrin or an Aleve.
What does work?
Well, basically, what I usually go is I have a handout called the top 10 things to do for arthritis, and basically we talk about like medications and ice. So people that can't take anti-inflammatories like Motrin, Advil, Aleve, or the prescription ones, Tylenol doesn't help as much, but it helps with the pain, and ice. Ice is usually great. I mean, icing, especially at the end of the day or after activities, ice will cut down pain and inflammation. So that's the key to it. The second thing is the exercise. The stronger muscles are around a joint, less force in a joint, less pain you have. Now, to explain to you, there's a difference. In my practice, people that have knee arthritis usually have pretty good motion. People that have hip arthritis lose range of motion because your hip is a ball and socket. So the ball cannot move in there. It kind of gets stuck. Your body is trying to fuse that hip. So what happens is most people that have hip arthritis that come and see me say, I pulled the groin muscle 2 or 3 years ago and it hasn't gotten any better. And then I'll say, well, you know, if you pulled the muscle, it probably would have gotten better. So you know it's not that, because the hip is really deep in your groin. So when somebody has hip arthritis, it's more in the groin than it is on the side of the hip. So the loss of range of motion is one of the telltale signs. If I examine somebody after I do their history, when I do their examination, if I can't rotate their leg, and if they tell me they can't put on socks and shoes at home, then I know they probably have hip arthritis of some type. And if it's not arthritic, then there's probably another issue like labral tear or avascular necrosis or something. So the key with the physical therapy and the step number 2, especially with the hip, is trying to get that range of motion. Some people find it harder and they find it painful when they try to go to therapy and try to get that motion, because your body is trying to fuse that hip. But you know, when I started 20-something years ago on younger patients, we used to fuse their hip. If they had bad arthritis, we'd put actually a couple screws across it to fuse it. But they were miserable as far as function goes. They couldn't get into a car easily. They couldn't get pants on. So a fused hip is not a functional hip. So that's the reason why we're trying to get that motion. And that's why on that 28-year-old we talked about earlier, we had to do a hip replacement on just to get him the motion so he could, get along in life. So exercise is number 2. That's a very key one. That's probably the most important. Then number 3 really is activity modification. And what that means is don't do anything that bothers it. You know what I mean? So if standing all day, like, it's hard for some people in their jobs because they have to stand. And I always say, can you modify your job anyway? Can you sit down once in a while? Like, even myself, I'm in the OR on Tuesdays and Thursdays and I'm standing for 8 or 9 hours. I find my legs get tired and stuff. So in the office, I always make sure I'm sitting down and doing things. And even in between cases on Tuesdays and Thursdays, I'm out there sitting down, making sure I'm getting my legs some rest. So for activity modification, if walking bothers you, which it can, then that's where you want to do stuff where your feet are on pedals or you're in the water. That's the best thing. And when you're trying to walk, try to walk more on level ground, on softer surface. Try to avoid hills and try to avoid stairs.
Okay.
Because it's 4 to 6 times your body weight when you're going up hills and stairs, and that puts a lot of pressure on the joints.
And you said there's 5 others?
Yeah, there's other things. Weight is key. I mean, the weight is very important because every time you step, it's 3 times your body weight. So even if you could lose 10 pounds, that's 30 pounds less of force on that joint. So we've seen numerous patients that have lost a lot of weight through different means, and they come back and they say their hip or their knee is feeling better. So the weight loss is very important. Another one is use of a walking aid. Now, most patients under the age of 70 don't want to talk about that.
Yes.
So I get the patients, and so in my handout it says using a cane or a walking stick. Usually, if you use a cane or a walking stick, you usually use it in the opposite hand. So if it's your left knee or left hip, you're putting it in your right hand, because when you step, that's the arm that's going forward. So the walking stick or the cane can help, but the appearance of it people don't like sometimes. But it could offload that joint by about 1/3 of its force, so it can be very helpful.
Well, in wrapping up our program, what are the last few?
So the injections, more for knees, but we do some injections for the hip. There's the cortisone injections, and then there's the hyaluronic acid, which are the lubricating injections. Those are more just for the knee. There's different types of braces, more for the knee than for the hip. So there's more options really for the knee than there is for the hip.
And the bottom line is you can live a good life with arthritis. It doesn't have to.
It doesn't have to control you.
Yes,
Yes.
Exactly.
Yes, you have a say on how arthritis is going to control you. And really what it comes down to is getting the proper diagnosis, getting the proper treatment early enough, and then going from there and keeping in touch with your doctor over time.
And you called it degenerative. So if you get diagnosed early enough, does your body tend to deteriorate as quickly?
No, usually, because then if you could do some things to strengthen the muscles to take the pressure off the joint, watch your weight, do those type of things, modify your activities. Like I've given up running and now I'm a biker. So if I kept on running, I have patients that come in, there's very little space left on their x-ray, so they're not bone on bone, but they're close, and they'll tell me they're going to still run their marathons. But if they stop running their marathons and went to biking, then they might get more life out of that joint. So that's why the earlier the diagnosis, the better. There are things you could modify in your life that you still have happiness with, but it can delay things as far as when the symptoms start showing up.
Last but not least, are there some things in your diet, some things you can take out or add to your diet?
Yeah, basically, the general part of that as far as arthritis and diet goes, is actually going to be the extra calories from the sugar and all that type of stuff. There are some foods that cause more inflammation in your body than others, and the heart doctors talk about that for, lessening the inflammation that they find, as far as heart disease goes. Same thing for your joints. That's why a lot of people are pro-Mediterranean type diet, so it's less red meat, you know, more fish and chicken and that type of stuff, more fruits and vegetables and stuff. So that the diet, there's no direct correlation as far as, you know, osteoarthritis and diet, but there are some foods that maybe cause more inflammation and stuff than others.
We've talked a lot about the knees and the hips. How about the back?
Yeah, so the back is a whole different story as far as again, that's where the proper diagnosis comes in. You know what I mean? Like sometimes it's just a muscle strain in the back, or you know, sometimes you could have a little degenerative arthritis, or it could be a disc issue. So that's where seeing the proper doctor to get the proper diagnosis is really helpful. And that's where, you know, again, you know, they would talk to you about the diet and the weight and the exercises, because a lot of people have weak core muscles, which are
Yes.
your muscles in your abdomen and your lower back, and that's where the Pilates and stuff comes in. So just a strengthening program to stretch, you know, the lower back and strengthen your abdominal, your core muscles is really important. Those are some simple things you could do, but that's where getting the proper diagnosis, because it could be, just because you have back pain, there could be 3 or 4 things that it could be.
Thank you so much for joining us, Dr. Brassard, and for bringing your
The knee monitor.
for bringing your sample so you can actually show us that this is the first time I've gotten a clear explanation of what it actually looks like inside there.
Right.
I know what it feels like,
Yeah.
but
Yeah.
I never knew what it looked like
Well,
inside there.
Thank you for having me. Appreciate it.
And in wrapping up our discussion, it's about the diet, it's about exercise, and
Being careful with your activities.
being careful with your activities. Thank you so much. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.